Am I just flexible or hypermobile? Let's find out together. And then what to do if it turns out that you are hypermobile. Let's start with some definitions. First, let's compare flexibility to hypermobility. Flexibility is the ability of a joint or series of joints to move through an unrestricted, pain-free range of motion. Now, several factors, such as muscle length, joint structure, and more can influence flexibility. It's a healthy trait, and it's typically improved with regular stretching and exercise, whereas hypermobility is the ability of joints to move beyond the normal range of motion. While it may seem beneficial, hypermobility can lead to joint instability, which leads to your joints popping out of place, pain, an increased risk of injury, delayed healing, difficulty feeling coordinated, so you just feel clumsy, to name a few of the problems. Now, notice that hypermobility refers to explicitly the joints and not other structures. It doesn't mean that muscles or soft tissues may not feel or appear tight. It's worth noting that hypermobility can be regional or systemic, meaning you may have hypermobility in a single or few joints, or it may be prevalent throughout most of your body. Now, before I demonstrate how to measure for hypermobility, it's important to understand the difference between regional and systemic hypermobility. Sometimes regional hypermobility may have a functional reason and may be purposeful for athletes, for instance. I'm going to give you a quick example that may at first seem unrelated, but bear with me for a moment and I'll tie it all back into how this relates to you. So for regional hypermobility, think of a baseball pitcher, for instance. They're repeatedly winding their arm back in order to create power for their throw. Over time, this repeated movement may lead to a regional hypermobility, where that shoulder moves excessively, at least compared to textbook norms. But this example has a functional purpose, however. It likely will not cause problems for the baseball pitcher because they're training for this specific purpose. The shoulder's hypermobility in this case may improve their ability to throw a baseball because they can create more of a wind-up for that throw. When hypermobility is widespread, meaning it's not just a single or a few joints, this is a completely different story. This is not something that's trained and usually has an underlying systemic cause. Now, back to the original definition. How do you know what is considered excessive range of motion at a joint, especially when there are variances between race, gender, and age, to name a few? Well, there's no perfect answer here. However, we do have some easy ways for you to screen at home whether or not the range of motion at one of your joints or multiple joints is considered hypermobile. In the example of the baseball pitcher, this movement is called external rotation of the shoulder. So you see here, we're starting at 0 degrees and then coming up to 90 degrees. While the exact values vary, an approximate normal range of motion is between 70 and 90 degrees. Granted, if you really look at this movement, it combines two movements, external rotation and shoulder abduction. But anyways, functionally, we look for the total range of motion of internal rotation and external rotation, which we would call the total range of motion, which you're seeing on your screen now. This is normally between 180 to 190 degrees. The total arc of that range of motion is 180 degrees in that case. When the range of motion exceeds this value, then the shoulder is considered hypermobile, which again is an example of regional hypermobility. Another example of this is in the hips with dancers, because they're often turned out with external rotation in first position. For example, they may develop a regional hypermobility. Now, when you start noticing this in multiple joints, or it is more widespread to the point where you could do cool party tricks growing up, this is more indicative of something systemic in nature. How do we measure this? Well, again, there is no perfect measuring tool. However, one of the most common screening measures used in clinical practices to identify hypermobility is called the Beighton scale. The Beighton scale looks at 5 movements to screen for a widespread or systemic hypermobility. The movements that make up the Beighton include bending your thumb back to your forearm, And you add 1 point if you can touch the thumb to the forearm for each side that applies. Then with the palm down on the table and the elbow at 90 degrees, lift your pinky up with the opposite hand. Does it bend beyond 90 degrees? If so, add 1 point per applicable side. Next, while standing, straighten the elbows as much as you can. If the elbow extends beyond 10 degrees, add 1 point per side that applies. In order to score this properly, this should be measured using a device called a goniometer, which looks like this and is commonly used in physical therapy clinics. Next, while standing, straighten the knees as much as you can. If a knee extends 10 degrees beyond straight, add 1 point per side that applies. Again, in order to score this properly, this should be measured using a device called a goniometer, as shown before. While standing, can you bend forward and place the palms of your hands flat on the floor in front of your feet without bending your knees? If so, add 1 point. A positive Beighton score is any score greater than or equal to 5 out of 9 points in adults, 6 out of 9 points in children before puberty, and 4 out of 9 points in adults over the age of 50, indicating systemic hypermobility is present. Now, you may immediately notice some potential issues with this scoring system. For one, if someone has had surgery on any of the above joints, particularly their hands or wrists, this may skew the results. Also, older populations may have already developed arthritis in hypermobile joints, so these patients may not appear hypermobile when in fact they still are. Hey, real quick, by the way, our mission with Hypermobility PT is to empower people with hypermobility or Ehlers-Danlos Syndrome to reclaim stability in life and joy in movement. So if you're finding value in this video, please subscribe, and we think you'll love some of the other things we're doing available at hypermobilitypt.com. So another way to accurately assess hypermobility is through a series of historical questions like the 5-point questionnaire or 5PQ. The questions include, can you now or could you ever place your hands flat on the floor without bending your knees? 2, can you now or could you ever bend your thumb to touch your forearm? 3, as a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits? 4, as a child or teenager, did your kneecap or shoulder dislocate on more than one occasion? And 5, do you consider yourself double jointed? That last question is kind of a strange verbiage and often tends to throw people off. All it means is that, do you consider yourself to have excessive range of motion in your joints? If you answered yes to 2 or more of these questions, it suggests that you are hypermobile, with a sensitivity of 85% and specificity of 90%. So if you met the criteria for the Beighton score or the 5PQ, you are hypermobile. With this information, what do we do now? Well, at this point, it's important to get a firm diagnosis of the underlying cause. For instance, there are 2 common diagnoses that cause the overwhelming majority of widespread hypermobility. The first is Hypermobility Spectrum Disorder, and the second is Hypermobile Ehlers-Danlos Syndrome. While there are other causes of hypermobility, these 2 are by far the most common. So how do you know if one of these diagnoses, HSD or hEDS, apply to you? That's what we're going to cover in the next video. So if you like this video, be sure to subscribe, and we know you will find value in some of the other work we're doing to help people with hypermobility. Visit hypermobilitypt.com for more resources and support on your healing journey.